I'm going to talk about intercourse during pregnancy. In my experience, and that's absolutely not scientifical, it was one third, one third, one third. Meaning one third was had less libido, one third was the same, and one third was like hot mama. I had a friend who said she couldn't wait for her husband to get home at 5 p.m. and then they would have sex almost every evening and all evening long. And the husband did not complain about that. You cannot harm the baby. Baby is in water with the amniotic fluid, so it cushions the movements, it protects the baby, and the uterus also protects the baby. There are some indications where you should not have intercourse. Always ask your doctor if you have any contraindication to intercourse. Some of them are if you have or had premature labor, if you're already dilated, if you're losing liquid, if you lost like the whole liter, or if you're dripping. These are two situations where you could have, you're more at risk for infection. If you have bleeding, if you have a low-lying placenta, that could make it bleed. Okay, so these are some of the contraindication. If you don't have a stable partner, or if your partner has other partners, use condoms. And it would be a good thing to talk to your doctor about checking for sexually transmitted disease, because if you have a sexually transmitted disease, and 50% of the time they don't give any symptoms, so you cannot say, well, I don't feel anything, I should be clear. If you have a disease, it could affect yourself and the baby also. Like, for example, if you have herpes at the time of birth or the week before birth, you could give herpes to your baby for life, and it's herpes from head to toe. So it's really not a gift you want to give your baby. So they give you medication to lower your shredding of the virus, and they might decide, and they'll discuss it with you, opt for a C-section, because that way the baby is not exposed to the virus of herpes. You might feel the need to be creative about the position, because with the belly growing, it might be uncomfortable to have intercourse. We don't recommend being flat on your back, because that compresses the inferior vena cava, so you might want to be on top. Or you could be side by side with your little leg on top of your spouse's leg, and then you can see what I mean. Okay, but you have to be creative. If ever after intercourse you feel like either Braxton's contractions, or you feel tightening in the bottom and you don't feel comfortable, usually taking a warm bath will ease the contractions and will relax your muscles and will wash out the sperm, so that way you don't feel the discomfort anymore. So that could be a solution. Some women, and I discussed that in another video, some women, if they want to induce labor or ripen their cervix, will have intercourse. It's a substance in the sperm that gives contractions and make the cervix softer. But then you should not go pee right after, because then the sperm falls in the toilet bowl and you don't have the effect of it. That kind of contradicts that we always say go pee right after intercourse, so you don't do bladder infection. So you choose whatever. But if you see that you have discomfort after the intercourse, then maybe you should go pee and not try to hold it in. It's okay to have oral sex with a pregnant woman, but it's kind of weird to say, but you should never blow into a pregnant woman, because in theory, there's a risk that you would blow an air bubble that could go in her bloodstream, and that could be fatal, actually. For intercourse after having delivered the baby, if you had stitches, most women will wait the postnatal visit at the office 4 to 6 weeks after birth. And by then, usually you have the okay from your doctor or your midwife that everything is closed and healed up. If you're concerned, if you had stitches, that it would be too stiff or uncomfortable, you can always do perineal massages again. If that's your perineum and if you had stitches here, you can put your thumb and you can massage. That will give back some stretchability to your tissues. And it will also show you if it pulls too much, then you go, okay, let's play cards, tonight's not ready. And if it goes well and you don't feel any discomfort, it shows you that it should be ready for intercourse. See you on the next video. Bye-bye.